Did you know that in 2023, over 70 million prescriptions for Amlodipine were filled in the United States alone? It's one of the most widely used blood pressure medications in the world. But here's what most patients never hear. There are 10 side effects your doctor is hoping you never find out about. Some are mild, others can lead to dangerous complications, and a few are so subtle you might think they're just signs of getting older. Stay with me, because number 7 can land you in the hospital if ignored. Amlodipine is a powerful medication. It helps lower blood pressure, reduces chest pain, and can even cut your risk of stroke or heart attack. For millions of people, it's a life-saving drug, but no medication is perfect. Most patients are only told about the common side effects like mild dizziness or swelling. What you rarely hear about are the hidden issues that can impact your heart, your liver, and even your long-term health. Knowing about these risks isn't meant to scare you. It's so you can spot problems early and work with your doctor to stay safe. This video is based on peer-reviewed research and information from the Mayo Clinic, Cleveland Clinic, New Hampshire S, PubMed, and the FDA. This is for educational purposes only and not medical advice. Always talk to your doctor before making any changes to your medication. Let's start with what's probably the most common and the most overlooked. Swollen ankles and feet. You might chalk it up to age, the heat, or a long day on your feet. But if you're on Amlodipine, that puffiness could be something else. Doctors call it peripheral edema. That's just a medical term for fluid building up in the lower parts of your body, usually your legs and ankles. Here's how you might spot it. Your socks leave deep marks by the end of the day. Your shoes feel tighter than they used to. Both ankles look puffy, even if your weight hasn't changed. Why does this happen? Amlodipine relaxes the small arteries in your body, especially the ones near the surface. But the veins, which carry blood back to your heart, don't expand as much. That imbalance builds pressure in tiny blood vessels called capillaries. And when that pressure gets too high, fluid starts leaking into the surrounding tissue. That's when your ankles start to swell. It's not rare. According to the FDA, up to 1 inch 10 people on a 10 milligram dose experience this kind of swelling. Women are 2 to 3 times more likely to report it than men. And older adults are especially vulnerable, especially if they sit or stand for long stretches. What can help? Prop your feet up when you're resting above heart level if you can. Cut back on salty foods. Sodium makes your body hold on to extra fluid. And if the swelling keeps getting worse, ask your doctor. They might reduce your dose or combine Amlodipine with another blood pressure medication, like an ACE inhibitor, to ease the pressure in your vessels. Compared to other common blood pressure meds, this type of swelling is much more common with Amlodipine, especially at higher doses. It's not just cosmetic. Fluid buildup is your body's way of telling you something's off. Number 2. Racing heartbeat and dizziness. It catches you off guard. One moment, you're standing up to grab the mail. The next, your heart is thumping in your chest, and the room feels like it just tilted. Amlodipine doesn't just lower blood pressure. It changes how your blood moves through your body, and sometimes your body reacts faster than you expect. 2 things happen at once. Blood vessels suddenly open wider. Blood pressure drops quickly. That rapid drop can make you feel lightheaded or dizzy, especially when standing up. In response, your heart speeds up. It's trying to keep blood flowing to your brain and other organs. The result? A pounding heartbeat that can feel alarming, even if it isn't dangerous in itself. These symptoms usually show up in the first few weeks of treatment, especially if you're over 60. You're starting at a higher dose, like 10 milligrams, or you already have naturally low blood pressure. Some people describe it as feeling flushed, lightheaded, or faint, especially after a hot shower or a glass of wine. If this sounds familiar, here are a few practical steps. Stand up slowly, especially after sitting or lying down. Avoid alcohol and overheating, both of which can make these symptoms worse. And talk to your doctor about whether your dose is too high. Many patients do better starting at 2.5 or 5 milligrams, then adjusting upwards slowly if needed. Compared to other blood pressure medications like beta blockers, which actually slow the heart, amlodipine is more likely to cause a fast heartbeat and that sudden dizzy feeling. Most of the time, this fades as your body adjusts. But if it continues or gets worse, don't tough it out. It's worth revisiting your dosage and making sure the drug is still the right fit. Number 3. Fatigue and brain fog. Some days, it feels like your energy just evaporates. You slept fine, you didn't skip breakfast, but by mid-morning you're dragging. Your arms feel heavy, your thoughts feel slow, and it's harder to focus on even simple tasks. This kind of lingering tiredness isn't just from aging or stress. For many people on amlodipine, it's a side effect that quietly drains their day. Fatigue, brain fog, and even low-grade nausea have all been reported, especially in the first few weeks after starting the medication. Why does this happen? Amlodipine lowers your blood pressure by relaxing the blood vessels. That's the goal, but sometimes it can go a little too far. When blood pressure drops too quickly or too much, your brain gets slightly less blood than it's used to. Not dangerously low, just enough to make you feel foggy, drained, or off balance. Add in reduced blood flow to your digestive system, and you might also feel a vague queasiness or lack of appetite. You're more likely to notice this if you're over 65, you already have lower blood pressure, or you're taking other medications that affect circulation. What helps? Stay hydrated. Dehydration can worsen fatigue and dizziness. Eat smaller, steady meals. Don't skip food, even if you feel a little off. Give your body a few weeks to adjust. Most people find the symptoms ease after the first month. But if they don't, your doctor may recommend lowering the dose or switching to a slower-releasing version of the drug. Compared to other blood pressure medications, amlodipine is less likely to cause drowsiness than beta blockers, but more likely to produce that lightheaded, washed-out feeling, especially early on. Tiredness may not sound serious, but when it starts interfering with your daily life, or it just won't go away, it's worth paying attention. Number 4. Gum overgrowth. You probably wouldn't expect a heart medication to affect your smile, but this one might. Some people taking amlodipine begin to notice something strange happening in their mouth. Their gums look thicker, puffier, almost like they're creeping over the teeth. This condition is called gingival hyperplasia, and it's more common with amlodipine than most blood pressure medications. You won't feel pain at first, but brushing becomes harder, your gums bleed more easily, and food might start getting stuck in places it didn't before. What's going on? Amlodipine seems to trigger certain gum cells called fibroblasts to produce excess tissue. That leads to overgrowth, especially if there's already plaque or inflammation present. According to research published in the Journal of Clinical Periodontology, up to 3–10% of patients on long-term amlodipine develop some form of gum enlargement. The risk increases if you take more than 5 milligrams a day, you've been on the drug for several months or more, you already have gum disease or poor oral hygiene habits. There's good news, though it's manageable. Brush gently but thoroughly twice a day and floss daily. See your dentist regularly, especially if you notice changes in your gum line. In some cases, dentists can trim excess gum tissue or coordinate with your doctor to switch medications. Compared to ACE inhibitors or beta blockers, amlodipine has one of the highest rates of gum-related side effects. It won't harm your organs, but it can hurt your confidence and your dental bills if left unchecked. Number 5. Worsening shortness of breath. For a drug designed to help the heart, this one comes with a paradox. In people with existing heart failure, amlodipine can sometimes make symptoms worse quietly and gradually. It may start with something small. You're out of breath climbing the stairs. You wake up in the middle of the night, gasping. Or your pants feel tighter even though your weight hasn't changed much. These aren't random signs. They can point to fluid backing up in the lungs, a condition called pulmonary edema. What's the link to amlodipine? When blood vessels suddenly relax, your heart has to pump harder to maintain pressure. If your heart is already weak, especially the left side, that added workload can cause fluid to leak into the lungs. The result: shortness of breath, fatigue, and rapid weight gain from fluid retention. This is rare in healthy individuals, but in people with known heart failure, valve disease, or severe coronary artery disease, the risk increases. Watch for signs like sudden difficulty breathing when lying flat, waking up, coughing or choking, gaining more than 2-3 pounds in a few days. If you notice any of these, don't wait. Call your doctor immediately. A dose adjustment or switching to a heart failure-friendly drug like certain beta blockers might be necessary. In clinical comparisons, amlodipine is generally safe for mild heart failure but can worsen symptoms in advanced stages unless closely monitored. And now that we've covered the first 5, let's hear from you. Have you experienced any of these symptoms while on amlodipine? Leave a comment below. It might help someone else spot the same issue. Number 6. Allergic reaction. This one's rare but serious when it strikes. Amlodipine can, in uncommon cases, trigger a severe allergic response. You're fine one day. Then suddenly, your lips swell, your throat feels tight, and breathing becomes difficult. This is called angioedema, a fast-moving reaction that affects the soft tissues under your skin. It's not something that builds over time. It can happen even weeks or months after starting the medication. Other signs to watch for include hives or rash, tingling in the face or tongue, difficulty swallowing or a hoarse voice. Doctors aren't exactly sure why this happens. It's likely an immune response, your body reacting to the drug as if it's a threat. People with a history of drug allergies are more likely to experience this, especially if they've had angioedema from ACE inhibitors or other blood pressure medications. If this happens, stop the medication immediately. Get emergency help. Angioedema can close off your airway in minutes if not treated right away. While this side effect is extremely rare, it's the kind of reaction where hesitation can be dangerous. Number 7. Dangerously slow heart rate. Some side effects creep in so quietly, they're easy to miss. Others, they could put you in the ER if ignored. This one falls into the second category. While amlodipine is better known for causing a rapid heartbeat in some people, it can do the exact opposite in others. A slow, irregular heartbeat, fatigue, feeling like you might faint when you stand up, or just sitting still with a pulse that feels too low. This condition is called Bradycardia, and it's rare with amlodipine alone. But when taken with other heart medications like beta blockers or digoxin, it becomes more likely. The mechanism? Amlodipine may interfere with the heart's natural electrical signals, especially if the conduction system is already weak. You're at higher risk if you're over 70, you're on multiple heart drugs, or you've ever been told you have a slow or irregular heartbeat. What should you do? Check your pulse daily if you start feeling dizzy or weak. If your heart rate drops below 50 beats per minute call your doctor. Don't ignore fainting spells. Bradycardia can lead to falls and serious injuries in older adults. Compared to diuretics or ACE inhibitors, this effect is uncommon, but when it happens, it's far more dangerous. This is one of those side effects that's easy to miss until it becomes an emergency. Number 8. Liver enzyme elevation. You don't expect a blood pressure medication to affect your liver. But in rare cases, that's exactly what happens. Amlodipine has been linked to elevations in liver enzymes, a potential sign of inflammation or stress on the liver. It's not something you'll feel right away, but over time, subtle symptoms can appear. A vague ache under your right ribs. Yellowing of the skin or eyes. Darker urine, even if you're well hydrated. Most of the time, the liver handles amlodipine just fine. But if you're already taking other medications, drinking regularly, or have pre-existing liver issues, the added burden can push things too far. The exact mechanism isn't fully understood, but researchers believe it may be an idiosyncratic immune reaction, a rare type of side effect that varies from person to person. Who's at higher risk? People with pre-existing liver conditions, those on multiple medications processed by the liver, and older adults whose liver function naturally slows with age. What can you do? Don't ignore early signs like fatigue, right-sided pain, or yellowing eyes. Ask your doctor for a liver panel. If anything feels off, one blood test can catch a problem early. And never mix alcohol heavily with medications unless your doctor clears it. Compared to statins or certain antibiotics, amlodipine is not a major liver risk drug. But it's one of the few blood pressure medications with documented cases of liver enzyme spikes. It's rare, but it's worth being on your radar, especially if you've had liver issues in the past. Number 9. Fluid-related weight gain. You're watching your diet. You haven't changed how you eat. But somehow, the scale keeps creeping up 2 pounds, then 5. It might not be fat. It might be fluid. Amlodipine can cause your body to retain water not just in your legs, but across your entire system. This kind of weight gain doesn't always show in obvious ways. Sometimes it's subtle. A puffy face in the morning. Rings that feel tight. A soft, bloated feeling around the midsection. Or your shoes fitting differently, even without swelling, you can see. Why does this happen? When amlodipine widens your blood vessels, it also alters the pressure dynamics in your capillaries. That allows fluid to leak out more easily into surrounding tissues. And if your kidneys are already working hard, or you're on other medications that affect water balance, that fluid doesn't get cleared fast enough. The result is gradual, fluid-based weight gain. People most at risk include those taking higher doses, especially 10 milligrams daily. Anyone with heart, kidney, or liver issues. People also taking NSAIDs or diabetes medications like pioglitazone. Here's what helps. Weigh yourself consistently, at the same time each day. Track swelling, even mild puffiness, is worth noting. If you gain more than 2 to 3 pounds in a few days, call your doctor. Unlike weight from food, fluid gain can spike quickly and reverse just as fast when the cause is addressed. Compared to other calcium channel blockers, amlodipine has a slightly higher rate of generalized fluid retention. It's not about vanity. It's about pressure both in your blood vessels and on your heart. Number 10. Possible cancer risk. This last one isn't about how you feel tomorrow. It's about what long-term use might mean years down the road. Some studies have raised a troubling question. Could long-term amlodipine use be linked to cancer? The research is still early and far from conclusive. But, A few large observational studies have suggested a slightly increased risk of certain cancers, including lung and breast cancer, in patients who've used calcium channel blockers like amlodipine for more than 10 years. It's important to be clear. This doesn't prove amlodipine causes cancer. It only shows a possible correlation, not causation. For example, a 2014 study published in JAMA Internal Medicine reported a 2.5-fold increased risk of breast cancer in women using calcium channel blockers for over a decade. Other studies haven't found the same link, so the medical community is still debating the significance. The possible mechanism? Some researchers suspect long-term changes in calcium signaling might influence how cells grow or die, but this is still theoretical. Should you be alarmed? Not necessarily. The absolute risk appears to be small. And for many people, controlling blood pressure is far more important than a very low potential risk down the line. Still, some groups may want to be more cautious. Patients with a personal or family history of hormone-sensitive cancers, women on long-term amlodipine, especially over age 65, people on high doses for more than 10 years. What's the takeaway? Don't stop your medication abruptly. Always speak with your doctor. Schedule regular cancer screenings appropriate for your age and risk profile. And if you're concerned, ask whether switching to another class of medication like ACE inhibitors or ARBs might make sense for you. Compared to ACE inhibitors or beta blockers, calcium channel blockers have raised more red flags in long-term cancer correlation studies, but again, no direct cause has been proven. Still, this is one side effect you won't feel until it's too late. So staying informed is your best defense. Before we finish, there are 3 side effects you should never ignore. Number 6, the severe allergic reaction. Sudden swelling of your lips, tongue, or throat. Difficulty breathing. This one can turn life-threatening in minutes. Number 7, an abnormally slow heartbeat. If you feel lightheaded, faint, or notice your pulse dropping lower than usual, it can quickly become dangerous if left unchecked. And number 10, the possible cancer link. You won't feel this one, but if you've been on amlodipine for many years, it's worth discussing with your doctor and staying up to date with regular screenings. If this video helped you, give it a like and share it with anyone who takes amlodipine. Make sure to subscribe and hit the bell so you don't miss our next update on managing blood pressure safely. For more information, check out the playlist linked on your screen. Stay informed, stay healthy, and thanks for watching.